Miss Pule Mulebati back again this week with your weekly dose of positive and uplifting news. This is Stories Untold. Welcome to this show. In the words of Winston Churchill, we make a living by what we get, but we make life by what we give. This quote is quite evident in the story of a philanthropist, Dr. Davies, who is passionate about empowering those who are less fortunate from all walks of life with different challenges that life has dealt them. We sat down with her, and this is why she's passionate about giving.
Born and bred in South Africa, Dr. Davies is a general practitioner specializing in restoring confidence to her patients. She comes from an affluent background. However, that hasn't made her blind to the plight of those less fortunate. Apart from responding to her call of duty, Dr. Davies also decided to take the bull by the horn as she dedicates her time helping those in need.
When I was very young, I was burnt by fire on my back. I think I was about 6 years old, and I spent 3 months lying on my stomach for a long time in hospital and then at home. And I don't remember it as a negative experience. I don't even remember the pain. I just remember thinking, seeing these wonderful nurses and doctors coming in and out and thinking, that's what I want to do with my life.
That experience alone changed her outlook on life.
I think being young and having burns and lying on my stomach and just having that short time definitely triggered something in me that I didn't want anybody else to suffer or feel like they had a disability. I was very lucky because I did fully recover, but I think that stuck with me from a young age. But just being a teenager and experiencing low self-esteem or seeing others around me, also having friends that have committed suicide, before I even started studying medicine, just made me very empathetic towards people's daily struggles. So when I started coming across at an early age at medical school, burns patients and scarred patients, I just really felt empathy towards them. And I just knew that one day I would be helping people like that.
And that is exactly how the philanthropist in her came to be.
So I'm very well paid for my day-to-day job, which is hair transplant. I love the surgery, and that really frees me up to be able to help people, on a pro bono basis. And these are mostly people who wouldn't be able to afford treatment, and there isn't this treatment in the government sector. So there's a huge lack, and unfortunately for every one person I help, there are 1,000 people who have asked me for help that I can't help. But where I can, I get sponsorships, my staff help when I'm not here, when the patients visit weekly, and I just try to help these people. If I look at it on a level of our country, a healthy nation is a wealthy nation. And we need to keep as healthy as possible, and I think the pandemic year has showed us that our health is everything. Our healthcare system is burdened, so the more we can do to prevent diseases, educate on medical issues, the better. And the more we can help people get their self-esteem back, the more they're going to contribute to society and to be able to have relationships, to be able to care for other people, and to get employment.
15-year-old Letitia Khatitswe is amongst the people whose lives and confidence Dr. Kathy is trying to restore. Burnt by a paraffin stove in October 2018, she narrates the day's tragedy as if it happened just yesterday.
Mama nareke mapele sharp, so like kaya ko kitchening ka lighta primer stove, kitse ke fitlisi mentšhisi ko stofong, then ebe thui. Then mama ka ba bitsa butwa ka koloi ya ge. A ba rekisa ko legatong, then a fitla ko legatong bang admita. So like ka dula ko ICU ba more than 2 weeks. Then bankisa ko warding ka dula le batho ba bang. Like ke tswile ka ka December ka 2018. Then mama ka ba re ke ye magaeng. Then from ko magaeng tse ke boa ke be ke ya ko legatong for the check-up. Ba mpela gore ke feditse, then ba bang kopantsha le Dr. Catherine. Then ba simolla go apply dilo tse dingwe mo sefatlhegong sa ka.
Before the incident, it was easier for Letitia to make friends, but that all changed.
Mana ba phela ba nteaser.
Ba teaser ba re?
Ba re ke ene sefatlhego.
So now because ba bona go le improvement ba re?
Khona le ba batla go ba le nne. Anexana gana gore nka ka motho ka nthusa. Nka mo leboga for le tsang ke tsang tso. Wa nthusa gore ke gone go ba le bana ba bang.
I get deeply hurt and sad and affected by seeing someone, so upset, even 2 years after the accident. And I think having kids myself just makes me relate to it even more.
How did you discover her?
A friend of mine is a plastic surgeon who is working at Laratong Hospital and knows about my passion. So he met Letitia in the acute stage where she had just had the burns, she had skin grafts, and they did a really good job of basically saving her and covering up the wounds. But he did believe that she could improve further. So one of the things in burns patients that usually happens is they get contractures. They get very stiff and tight, and when Letitia came to us, she couldn't actually lift her chin off her chest. So our priority before dealing with the texture of the skin was actually just to get her mobility in her neck. So she's been coming to us for some treatments for that. And I think she's really improved. I mean, if I look at her sort of original when she came to us, how tight, she really was constricted there and there, sort of chin on chest. She used to walk around, and she used to walk around in a scarf. So she's really come leaps and bounds from the point of view she's mobile, she can move her neck, she walks around in a normal t-shirt, she doesn't wear a scarf in the middle of summer.
Ke bereki, ke na monna, ke na le bana ha ba sebetse ka sokola. Dr. Catherine a gona problem ma Letitia. Ke sa Letitia, ke tlo mo thusa mahala. Ene ke ga ke qala mo tlisa mo re fitla o re fa tšhelete ya o ya go gae, o re fa tšhelete ya dijo. Until no, I think now we ka ba 3 years. Dr. Catherine ali busy le yena. But Dr. Catherine mo tsere maybe 2 months. Ke ga ke bona gore Letitia go tswa mo go tlang wa tla o tla sentle. Jara ha e fela ke ga Letitia setse o mmona gore o shota fela kwale yena o right. Sefatlego sa gagwe ke sela sa before acha. Dr. Catherine a ke tsebeng ka mo eletsa eng. A ke na nix but a ke tsebeng ka mo eletsa eng. Mara go tla bonala modimo teng.
The one thing about working in South Africa is we have access to first world medicine and third world medicine. So first world medicine, there are a lot of breakthroughs in scars and burns, one of them being growth factors, but they're incredibly expensive because they, manufactured in a lab, and a tiny little amount like this can cost up to about 5,000 Rand. So people with the means will go to a clinic and pay that. But every now and then, a company will actually sponsor a patient, especially with burns. Most of the first world cases, they're using it for scars or maybe wrinkles. So, this is really a worthy case. Although she's still emotional about her injuries when talking about them, to see her, she came walking through confidently in a t-shirt with no scarf is really just amazing to me. It makes my heart happy. But we're not done yet.
In February of this year, 15-year-old Letitia, a burn survivor, started in a new school. To avoid the mocking that she endured at her old school, Dr. Davies also sought help from friends who have walked the same path as Letitia.
So one of the saddest things for me about burns or scars or whatever patients go through is a loss of self-esteem. And when I think of myself as a teenager and look at my own teenagers, where as much as a pimple can give you low self-esteem, I cannot imagine what it must be like for Letitia to go to high school and not be 100% happy with herself or always comparing to how she looked before. So it's very, very important to educate and make her colleagues and friends aware of what she's been through. I have actually been burnt, but not on my face, and I don't really have many scars left. But a friend of mine, Itumeleng Seku, is a public speaker who was burnt really severely, and is just the most amazing public speaker. She gets the message across, she gets the kids involved. So I thought it's a really good match to get her and Letitia together and just boost Letitia's self-confidence at school.
I just want to introduce myself. So I'm Letitia's doctor and Itumeleng's friend.
I'm a motivational speaker. I am an entrepreneur. I have a YouTube channel, the Itumeleng Siku YouTube channel, where I cook, just to show people that just because you've got one hand and one finger doesn't mean that you can't live, and you can't do things. I mean, I do everything myself. So we are here to motivate the grade 8s because of a young, beautiful girl called Letitia. She is in grade 8 and she got burned. So the classmates normally used to mock at her, and make fun. So I then come as a motivational speaker to show them a success story, of someone who has walked that path, but yet has become the person that she is today.
Itumeleng was only 11 months old when she suffered severe burns to her body following a fire at home. She lost 4 fingers, her right arm, and an ear in that incident. 3 suicide attempts later, Seiku lives to tell her story.
The teasing and the bullying affected me so much so that it crippled my self-esteem to that point where a part of me just felt like, what, I don't want to be here, I don't want to be alive, let me just die rather. And I've tried to commit suicide since grade 5 until grade 11. My very last suicide attempt, I drank 300 pills. Nothing happened. Boring, but I'm so happy that it didn't, because I wouldn't have found out what my purpose was.
And these are the words she imparts to Letitia.
I hope that she knows that she has a future. When I got burnt, I didn't have some sort of an example, someone that said, you can still make it, you can still be successful. You just need to find that strength and that power that lies within you. Lao Tzu says it best, and he says that mastering another person, that is called strength. But mastering yourself, now that is called true power. And that's where your life really, really lies, because it first starts from within you. It took me 19 years of living in this hell hole, a life where you don't want to be seen, a life where you don't want to party, you don't want to live. But this 1 year where my spirituality sort of like took my heart, my mind to the next level, that's when I realized that, shucks, I actually have such a beautiful life.
Having risen above her challenges, Itumeleng, who is now a social activist, continues to use her story to motivate other burn victims. Stephen and Hlengi, who are both acid attack survivors, stand to gain a lot from Dr. Davies' work. She has brought them here to meet Itumeleng in an attempt to help them shift their mindset from self-hate to self-acceptance.
Chemical burns from a substance can actually be worse than being burnt by fire. I think people don't realize that. And, you know, even with something as simple as drain cleaner, you can walk into a hardware and buy something that can brutally attack something. And another thing they have in common is that their life was changed in a matter of 5 seconds. The minute that substance touched their skin, their life was changed for good. They've both come on in leaps and bounds. They're such amazing, incredible, positive people. Both Stevens and Klengi always come in here with a smile on their face. But I feel that there's still a lot of healing to be done and confidence to be gained.
And fortunately, without wasting any time, that process is underway.
I met Itumeleng probably about 3 years ago. Someone introduced her to me. We were actually filming a show about eyebrows and restoring her eyebrow, and I was just blown away. What I saw walking through the door, this lady physically, and to like what my mind perceived, and when I met her, and her spirit and her soul was just really mind-blowing. And I think we just hit it off straight away. And we had a sort of mutual interest. I love that she's here to provide hope, because, you know, that's my passion, is, you know, giving hope where hope was lost.
What do you want to see come out of this relationship?
Out of this relationship, I want the three, you know, Stevens, Klengiwe, with the help of Itumeleng, to just have a safe space where they can find hope together. It must be amazing to be able to talk to someone who's been through something similar to you. So I'm their doctor and I can give physical healing, but I haven't experienced what Stephen's feeling. I haven't walked in the road and a child has said something about me. So I think it's very important to connect with other people who've had that experience. And it's all about actually creating a community.
Dr. Kathy's philanthropic work doesn't focus solely on surgery. She also helps young women find access to employment through education.
One of the things I think we all find totally heartbreaking in South Africa at the moment is the high level of unemployment. So I decided, and this was more challenging because of the cost of it, was to focus on trying to educate people where I could. And I believe that educating a woman, filters down to so many people. So I've had the privilege of being able to help towards educating a few very talented people. And I hope that it will grow in future, but at the moment it's one by one.
These one-on-ones include 3 members of her staff.
It was a huge commitment to decide to take on a university student. But I actually started my first year in pharmacy, and when I heard there was this promising young girl who really wanted to study pharmacy, it just struck a chord with me. So I decided to just save up annually and make a plan and put her through university.
18-year-old Lebohang Khoza is the young girl the doctor is referring to. On top of the R500,000 the doctor has set aside to educate her, she's also making sure that she's well equipped with resources for the journey.
Ngikhulise umgogo from ngisakhula, then ngize ngiqede manje esikoleni. Then my mom wasn't like full-time there, but siyahlangana naye sikhulume. Then uhlala e-Orlando East, asihlali naye. Ngihlala nogogo nobhuti wami phakathi egarage. Then ngihlala phakathi ejardini, it's a family house. Then bakhona abahlala endlini, and I've also got abo malume nabo aunt abahlala emarumini. Ikahle ngiyo esilethela ukudla endlini, then nogogo naye usebenzisa imali yakhe grant to buy ukudla. Then if inokuphela sometimes
ayoboleka imali so that sikwazi ukuthi sidle.
Because of that situation at home, she believes the doctor has put a silver lining in her dark cloud.
Besingizozama uku-aplayela i-NSFAS, not knowing ukuthi bizongithatha, but without a doctor I don't think it would be possible. Because akekho umuntu obengangifundisa endlini. Akekho umuntu osebenza kahle kangaka ukuthi beke ngakwazi ukuthi engifundise, nogogo akakwazi ukuthi angifundise enhloko. So beke ngekho umuntu ozongifundisa.
And this, she says, is the least she can do for her grandmother.
Ngiyenzela yena nomama mhlambe one day so azi ukuthi sihlale sonke if we now have a bigger space. Then ugogo has been through a lot ezamila thina ukuthi singalali singadlanga, have clothes, sihambe siye esikolweni. Bekungeke siye esikolweni singcolile. Never. Bezama ngawo konke esemandleni ukuthi akwazi ukuthi athole insipho ukuthi asiwashele njalo silali singadlanga. So yeah, it's the least thing engakwazi ukuthi ngimenzele kona. Dr. Kathy ngathanda ukuthi ngiyabonga ukuthi engisize ukuthi ngifeze amaphupho wami. Engisize nje ukuthi ngikwazi ukuphila nami impilo engcono. Angazi ukuthi ngambonga kanjani.
Her granny does not forget to include the doctor in her prayers.
Kumusa kaNkulunkulu. Manje ngibonga kakhulu engiyamthandazela ukhethi. uNkulunkulu ufana nengilosi uNkulunkulu angithumelele yona ukuthi izongikhipha usizini.
Umzukulwana wakho uthanda umbone kule.
Oh, ngamthanda ukubona ephezulu yazi, endaweni ephezulu. Abe nayo yonke into aqonde naye, kungabi khona okumphazamisayo. Angaba sabheke eceleni njengoba uNkulunkulu esembhekise phambili. Angaba sabheke eceleni.
This is Joshua House for Abandoned Children. Dr. Davies and friends are donating nappies and food.
I love children. Got an absolute passion about children. So although the bread and butter of my job is actually doing hair transplants, which is more sort of vanity related, wherever I can, I like to help because that's my passion, my feel good, it's my why.
One can't help but wonder how much all of this good work actually costs her.
Quite hard to add it all up. But I think the university costs are the highest because the medical treatments are more my time, and I do get the odd thing sponsored, purchase some of them myself. I do feel awkward about, talking about everything I've done because my colleagues have been on the front line, some of them losing their lives during COVID. But I think the reason that people love hearing about my patients and their stories is the whole focus on self-esteem. And whether it's someone who's been severely disfigured or someone with mild acne, there's such a focus on the physical. From all the work that I do, I just want people to think you don't have to be a doctor or a lawyer to help people. The most amazing things I've seen with patients who've come in or people who've helped patients are everyday people and what they're doing. Anybody can help. There's such a huge need in South Africa, and it doesn't have to be all or nothing.
And in an effort to live a full life, we must step out of our comfort zone in order to widen our view. And Dr. Catherine Davies is well on her way on this journey. From myself, Pule Mulabati, and the rest of the team, it's a goodbye.